I'm Dustin Hardwick, a physical therapist with a PhD in movement science. Today is a mini episode. We're going to be looking at the viscoelastic properties of tissue. Now that we have our slides pulled up, let's get started. First definition, anisotropy. What this means is that the mechanical properties of tissue, they're going to vary depending on the direction of force, which have a lot of important clinical implications that we'll get into as the series of podcasts move on. So it's an image over here to the right. You can see that there are more hotspots in the Achilles tendon when it's loaded laterally versus when it is loaded vertically, which is the normal direction of loading of your Achilles tendon. And that makes sense that you would have more stress when it's loaded in directions that it's usually not loaded in. And that's because the collagen fibers, they align with the direction of that force. So it makes sense that there'll be less hotspots when we load the Achilles tendon in the direction that is usually loaded in. How do we visualize this tissue behavior? We look at the load deformation curve. Another way to say that is a stress strain curve. There's a difference between these two. So a load deformation curve is the load versus deformation of the whole tissue, so the whole Achilles tendon, versus a stress strain curve. That just means you divide out the size of the tissue, so then you can compare tissue from different size body parts. You could compare an Achilles tendon to a patellar tendon. You can only do that with a stress strain curve, whereas that load deformation curve is the whole structure itself, so that doesn't allow you to make comparisons of different sized tendons, different sized ligaments. Let's take a deeper look at this load deformation curve. So on this graph, and if you're following on a podcast audio, you can see these slides on my Substack, or you can come back and see it on Spotify video or on the YouTube video. The graph to the right here has a load on your vertical axis, so that's the amount of stress on the tissue if you think about just the tissue itself. So the load is how much force you're putting on the tissue. And the deformation is on our horizontal axis, so that's just the change in length of that tendon, of that ligament, of whatever that tissue is. So we're looking at a graph of how much load to how much it's deforming. And there's a few different regions broken up here on this graph. The intercept to A, that's your toe region. So in that toe region, you're just aligning those collagen fibers. So at rest, most tissue has some wavy patterns to it, meaning that there's some slack in it. In this toe region, or this very first part of the graph, we're just taking that slack up. So your toe region is taking up the slack. The next region is our elastic region. In the elastic region, when I load that tendon or that ligament, and then I unload it, the deformation or that change in length, it goes back to its original length. So think about a rubber band, which is elastic. If I pull a rubber band out and I release that tension on it, it comes back to its original length. So within this elastic region, the difference in the tissue length is transient, meaning that it will return to its original length after that load is reduced. And that's an important region. A lot of our activities of daily life, our normal movements, they occur in this toe and elastic region. That's where most functional activities are in, because we don't want to have a permanent change in our tissue. Beyond B, now we're getting into this plastic region. When we get into this plastic region, the change in that length or that deformation is relatively permanent because there's some micro trauma going on inside that tissue. So within this plastic region, if I lengthen that tendon, I lengthen that ligament, and then I release it, it doesn't go all the way back to its original length, meaning there's some permanent damage to the tissue, some micro tears in it, meaning that deformation is relatively permanent. So we can take advantage of this plastic region during something like stretching. So in stretching, we want to make a relatively permanent change in the length of a tendon, for example. We might want to get into this plastic region so that that length is relatively permanent. This plastic region can also be not so good. So if your posture is poor and you're slumped over into your device, your computer, your iPad, your iPhone for long periods of time, the tissues on the posterior aspect of your spine can enter this plastic region, and you can have relatively permanent changes in your posture because of that. Moving on from here, once we get to C, this is the ultimate failure point. At this ultimate failure point, the tissue is fully ruptured. So I would pop a bicep tendon, meaning the load's going to completely fall off because I've completely ruptured that tissue. So let's quickly review the load deformation curve. So intercept to A, toe region, we're taking up the slack. A to B, that is the elastic region, meaning that once I take a load and deform that tendon length, it's going to go back to its original length afterwards. Our plastic region, which on our graph is from B to C, at this point there's micro tearing. So when I put a load impart a load upon it and I lengthen that tissue, it doesn't go back to its full length anymore. So that's our plastic region. And finally, we have our ultimate failure point where the whole tissue breaks, the whole tissue fails. We've popped that tendon or that ligament. Young's modulus. This is the calculation of the stiffness of a tissue. So what it is the slope of the elastic region of that stress strain or that load deformation curve. By looking at the slope of that elastic region, it'll give you some idea of how stiff a tissue is. So think about the clinical relevance here. Your Achilles tendon is much stiffer when you impart a load lengthwise on it, which is usually how we load that tendon. And we want that stiffness or that higher Young's modulus, as you can see on your graph over here. The higher slope means a stiffer tissue. You want that tendon of that Achilles to be stiffer when I load it in its normal direction, because I want to take the force that I generate in my gastroc-soleus complex, and I want to take all that force and impart it into the ground so I can push off, so I can jump, so I can run, so I can walk. So I want my Achilles tendon to be stiffer in that vertical direction. It's going to be less stiff in that horizontal direction, which we kind of started today's discussion about, because I want some compliance. If I move that tendon in a horizontal direction, I plant to the side and I get a little bit of shearing force across that tendon, I want it to have some compliance there so it's not as easy to rupture when I load it in that horizontal direction. So big picture here, it's the slope of the elastic region of that stress strain curve. A stiffer material is going to have a higher Young's modulus. That can be a great thing if I want to take my muscular forces and impart it into the bone it's working on so that I can push off, so I can lift a heavier weight. I might want a lower Young's module when I need something to be more compliant, when I need it to have a little give so it doesn't rupture as easily. Let's move on to the concept of viscoelasticity. And all this means is that biological tissue have some properties that are elastic, like a rubber band, and some properties that are more fluid-like. So let the name help you here. Visco is viscous, so that's fluid. Elasticity, that's elastic. So if you use the word viscoelasticity, it will remind you that the definition is that biological tissue has some properties that are elastic-like, some properties that have a little bit more fluid-like properties. So our four main viscoelastic properties: creep. If a constant force is applied over time, the length will gradually increase. Stress relaxation, a similar term, but with kind of a different implication. If a tissue is stretched to a specific length, the force needed to maintain this length will decrease. Hysteresis, when you load and relax a tissue, the slope of that curve is going to be different because some of that energy is lost as heat. Strain rate sensitivity, tissue behaves differently if I load it rapidly versus I load it slowly, meaning that it'll be stiffer if I load it more rapidly, and it'll be more compliant if I load it more slowly. Let's go through each of these in turn. Our first viscoelastic property is creep. Again, if I apply a constant force to a tissue over that time, that tissue will gradually lengthen. So my best example of this is a low load stretch to improve the extensibility of a tissue. So I want to regain knee extension. What I can do is I can put a constant load. So in the case of our picture here, maybe this is a 10-pound weight cuff. We put that over the area right above the knee. That's going to put a constant load into knee extension. And that's going to, over time, gradually increase the length of the tissue that's causing that decrease of knee extension, whether it's the hamstring muscle, whether it's a posterior capsule. It's going to exhibit that property of creep, meaning I'm not pushing any harder. That cuff stays 10 pounds throughout, but even though it's the same weight, that same force, we're going to get a gradual increase in the length of that tissue. Our next concept is stress relaxation. So now we take a tissue and stretch it to a specific length. The force needed to maintain that length is going to decrease over time. So what's being held constant here is the position. So I'm taking a tissue to a specific length, and over time, the force needed to maintain that is going to decrease. An easy clinical example, and you can do this on a friend, on a partner in school, is take somebody and put them into hip flexion, like a straight leg hamstring stretch. Find a position that has some resistance and just hold it. Over time, you will see that the force you need to push into the leg to maintain that 80 degrees of hip flexion, 90 degrees of hip flexion is going to decrease. That is stress relaxation. The force needed to maintain that length is going to decrease over time. Our next concept is hysteresis. What this means is when you lengthen and relax a tissue, the load deformation does not follow the same path. And the difference between those two paths is the heat being lost, or some of that energy being lost as heat. A good clinical example of this is an active warm-up where you're repeatedly lengthening and relaxing tissue. It actually generates heat within those tissues, making them more pliable, increasing the local blood flow to that area. So this is a really practical example of using this nebulous concept of hysteresis to our advantage. We can develop some local heat in that tissue by repeatedly lengthening and relaxing a tissue, and that difference between that low deformation curve path is going to be that heat loss. Our last concept is strain rate sensitivity. And all this says is tissue behaves differently if you load it rapidly versus load it slowly. Tissue is always going to be stiffer when you rapidly load it. And this is an adaptation that we take advantage of every day. So let's go back to our example of that Achilles tendon. If I want to jump off the floor onto a box, so we're doing a box jump exercise here, I want to impart all of those forces from my calf into my foot so I can jump as high as I can. By loading that Achilles tendon rapidly, it's going to be stiffer. It's going to allow more of those muscle forces to actually be imparted into the floor so I can jump higher. However, when I'm just walking around, not jumping, not sprinting, not running, just walking casually, I don't want to have all that stress on my Achilles tendon. So when I load it slowly, it's less stiff, it's more compliant, which means there's going to be less stress to that Achilles tendon. So strain rate sensitivity is a really important concept, and plyometrics and sprinting all take advantage of this property so that our tendons can be stiffer when we want to impart those muscular forces more rapidly. Finally, I have a review of each of the properties here. So you have the property on the left. We go through creep, stress relaxation, hysteresis, strain rate sensitivity. I have the definition here for you, and I have some examples in the human body so that you can make a clinical correlate to this property here. So I'm going to leave this up for you for a second, and you can look it over, screenshot it. You can also hop on over to my Substack, and you can get these slides with the transcript, and you can kind of review them on your own time. That is all I have for this short episode on viscoelastic properties. If you want to see more of these shorts, leave me a comment down on the video, and I'll make some more focused short descriptions of different properties. Have a great one, and I'll see you next time.